All right, welcome back. Thank you so much for staying with us. Being a Thursday, it's Health Thursday, and this morning we're looking at our food health. Have you ever heard of the word podiatrist or podiatry? I guess not, but that's why we are here this morning, and that's the conversation you're having. If you're like me, this is a very great conversation, and it's quite timely because I've just twisted my foot before we started the show, and it's quite painful, so we'll get that checked as we continue with this conversation. This is a health condition that you might not be quite familiar with, and that is why this morning we have Dr. Fabian Collis. He's a podiatrist at MP Shah Hospital. He'll be telling us more about, our foot health, what we need to know, what we need to do, and what we need not to do in order to take care of our foot health. Welcome to TV47.
Thank you.
And to Morning Cafe.
And thank you very much for having me.
It's your first time here?
It is my first time.
Amazing. We love guests, and on this show every Thursday we love to learn about matters of our health.
Yeah.
And just to lay the foundation for this conversation, podiatry, right?
Yes.
Most of the time when we're talking about foot health, the first person we think about is an orthopedic. Then how different are you two, and how do you come in as a podiatrist?
So when you talk about orthopedic surgery, you're talking about surgery relating to possibly the foot and ankle, but general orthopedics is a doctor who deals with fixing bones, structure, fractures, that kind of thing. Podiatry is a branch of medicine that is subspecialized to just deal with the foot and ankle. We are podiatric physicians who basically just specialize in the foot and ankle, all its pathologies, disorders, and we study it just in that area. So we don't go above the ankle. So that comes with anything to do with the foot. That's whether there's children's feet, foot health generally, footwear, bone structure, skin, corns, calluses, bunions, all of that. So orthopedic specialists are people who generally do everything in the body. They're surgeons who deal with anything to do with knee surgery, back surgery, hip surgery, everything. But as podiatrists, we just subspecialize in the foot and ankle only. Because if you imagine, let me give you a little bit of background.
Yeah.
There we have 26 bones in the feet. A quarter of your bones are in your feet. We walk the equivalent, we carry the equivalent weight of a blue whale every mile we walk. We walk 8,000 to 10,000 steps. Our feet are incredibly important because if you didn't have feet, we wouldn't be sitting here because we wouldn't be able to be mobile. So it's like tires on a car. If you don't have tires on a car, it doesn't matter how good the engine is, your vehicle is not going to be moving. And
that's why foot health is quite important.
And that's why foot health is so important because, have you ever had something where you've got a stone in your shoe or if you just walked across here and you twisted your ankle and it hurts like hell.
Very much.
Yeah. And now it'll just make you miserable for the rest of the day if it continues to hurt.
Yeah.
So foot health is incredibly important. Footwear is incredibly important. If we get kids' feet early, we then prevent all these problems. And 60% of pain in the back, in the hip, is related to the way we walk and the way we stand.
Oh, wow.
Did you know that? So if you you're fixing a cause of why something's happening, not just a symptom.
All right.
And that's why foot health.
So sometimes when people come to the hospital, when they say they're having back pains, sometimes it's caused by the structure of the foot.
Yeah, so it's called biomechanics of the foot.
Okay.
So in biomechanics of the foot, it's the way we move. So if we have a problem with very high arch feet or flat feet, we tend to stand in the wrong position. That then works in a chain reaction all the way up. And it works in a stocking distributed way. So what it does is it starts distally, which is at the toes, and it migrates proximally towards the knees and the back. So if you are someone who's had persistent back pain, you've seen the physiotherapist, you've gone to see the orthopedic surgeon for back, they've prescribed possibly surgery, but not yet because you're still young and they want to wait and see. Have you ever thought that it could actually be that your feet are in the wrong position when you walk? Because you're flat-footed, you tend to rotate inwards. And that then creates a chain reaction all the way up to the knee.
Yeah.
And then if your foot is constantly moving in the wrong way when you walk, that then will create knee, back, tired legs. And that's why often you'll get patients who will tell you, I hated running at school because it always made me so tired. And the reason it made me so tired was because I'm flat-footed.
Okay.
Or I have a very high arch. And general rule of thumb is people with high arches are much more prone to back pain and hip pain. People with flat feet are much more prone to knee pain and ankle pain.
Show us practically. How does a flat foot
So
look?
if you have a flat foot, right, then the arch is completely flat, so there's no structured support. So what happens is when you walk, you tend to go inwards when you walk. So if you look at something like this, we're dealing with, that is corrective alignment. Yes, like that.
Just show
So
that to your camera.
if you have, I don't know if
This
the camera
camera
can
too?
use.
This one?
Yeah, so if we have that, then we look at a foot like that. What we're looking at is we're looking at overpronation. So if I can show you from this perspective, and that's also why I'm wearing trainers, by the way.
All right.
Because I wanted to show people that actually you need good shoes. Because shoes, I could have worn different shoes, but then I would be promoting shoes that maybe wouldn't be suited for general health.
All right.
Yeah. So when you walk, we tend to strike. So the 7 bones in the back of the foot unlock to adapt to the ground strain and become an adapter. When we transfer weight forward, we then become a mobile adapter, and the foot then gets propelled forward. Then we go into what we call the toeing off phase, which allows the body to walk through. So the foot should be used as a shock absorber, adapter, and a lever. Now, if you are flat-footed, your foot will then transfer weight inwards too much and too quickly. So watch what happens. You see my knee then goes in like that. I then don't have any support structure with my foot. So my foot then goes in like that, and now there's no structure of support for the knee. So that's why people end up with what we call patellofemoral syndrome or medial knee pain. And if you just correct it with a simple type of device like an insole, something that will hold the foot and the arch in the right position, something that can go in your shoe. It's like glasses for your feet. And that will help to stabilize your foot. And again, if you have a high arch foot, then very often the foot can then be you can walk on the outside of your feet. Which means then you transfer, and then your foot doesn't shock absorb properly. So what eventually happens is you end up with pain on the proneal muscles, which is the lateral side of the muscles, going into the lateral condyle of the knee and coming into the hip as well. So these are all things, Anne, that you need to look at, and that's why it's incredibly important that you look after your feet. I've always said there's 2 things you should invest in, a mattress,
a mattress?
a mattress and good footwear. Why? You spend half your life in one or the other.
Yes.
So remember, footwear is incredibly important. And then we address fashion as well.
Before we get into fashion deeply, how is mattress coming into play? Because, you know, most of the time we're sleeping, our foot, are just laying down. But I understand that with footwear, you're moving all the time. Then if you're sleeping, then how does mattress come into play?
No, it was just an analogy. What I was looking at is I was saying that if you, because you spend half your life sleeping and you spend half your life walking. You need to invest in good shoes. And a good mattress so that you get good sleep and you function properly in the daytime with your walking.
All right, talk to us about fashion. We have looked at, some trainers which you have on, but now talk to us about ladies. We love our stilettos so much. And before we got in, I twisted my foot. I see you looking at my shoe. I know it's quite high. So is it really safe for me when you look at it?
Okay, so when do you think you should buy shoes? What time of the day do you think you should buy shoes?
Buy?
Just a question to you. So when would you, so if you, as Anne, were going to buy shoes that day, when would you do it? Would you buy it in the morning or would you buy it in the afternoon?
Afternoon. I would in the afternoon.
Why?
Well, that's when I get the time to go shopping.
Okay.
Yes.
So that's time, but generally you should always buy shoes in the afternoon because you allow for natural swelling and you allow the foot to, so if you are someone who's got swelling in your ankles or you've got irritation with your feet, then always buy shoes at the end of day, general rule of thumb. And remember, when you buy a shoe, it should fit straight away. Do you know, like the shoe bites you? Yeah, but I love it because it matches that outfit I bought last week. Never do that. And the difference between men's fashion and women is men will generally, maybe not so much anymore, but generally they will buy a shoe because it's comfortable and supportive. Women will buy a shoe because it matches, my wife is included in this, because it matches an outfit that she wore like 2 weeks ago. So she will buy a shoe. So women's shoes don't necessarily have to be functional and comfortable. They just have to look good on the outside. And that's why women are 4 more times likely to develop foot problems because of this than men.
What are these foot problems that you see women present with?
So you see, if you get, nothing should be over 2.5 inches in height. Because you should always have a heel, so never flat, so you never do something like that. And a shoe should always be able to bend 1/3, not like that. So if you can bend a shoe like that, this is my wife's shoe. If you can bend a shoe like that or rotate it like a pancake like that, it's a very bad, ill-fitting shoe because it's not going to give you any functionality or support for your foot. So it won't hold the foot, so it'll just be floppy. So ballet flats, pumps, these kind of things should always be checked. And you should have a shoe that bends properly. It should be able to bend at that point, like that. It shouldn't bend here. Because remember, we bend at the front third of our foot. So if it bends in the wrong way, it's not going to give you the structure you support. So nothing over 2 inches, and make sure it fits comfortably straight away. Listen to that little voice. This is something I always tell my patients. Listen to that little voice when you buy shoes. If that little voice goes, no, don't buy that shoe, because what will happen is it'll bite your foot and it'll damage your foot irreparably. And so simple things that people from ill-fitting shoes, corns, calluses, because they stuff their feet into something the size of a pencil. Okay, nothing that's sharpshooting. You should have something that fits straight away. So if you put a shoe on and go, oh, that's lovely and comfortable, it fits like a glove, then you can use that shoe, you can buy that shoe. That's important.
You want to demonstrate with mine? And tell me if actually it's a safe shoe.
Okay.
Is this a 2-inch?
Yeah, so this is just, no, this is 3 inches. This is 3 inches, so this is just. So let me ask you a question.
Yes.
All your weight will go onto this area.
Yeah.
And you see, you could stab someone with that thing.
Yes.
Okay, so you will be squashing your foot into something the size of something that's very small. So if you are someone who gets natural swelling, and also if you're, say, if you're aging as well, your feet will naturally swell anyway, because the blood flow is poorer to your feet. You will be stuffing your feet into something that will not fit properly. And eventually what will happen is this will damage the foot in here. And also look at the material of it. As much as a nice shoe, and I think a lot of people go for heels because it defines the calf, it makes them stand up well. And a lot of women from height, they want the height, so they wear high heels like that. So a shoe like that, and you see it's very rigid, doesn't bend. So there's no give there. So you will be now transferring weight right on just that area. So this is why people end up with Morton's neuromas, metatarsalgia, which is pain in the forefoot, and inflammation of the metatarsals, which is the front of the foot. So the metatarsals being, thank you very much, the metatarsals being sort of this region of the foot. So this is, so if you imagine that's your bone structure, okay? And you're wearing a high heel, now look where the center of gravity is. It's right there. So you're not using any of this part of the foot. And okay, so we have 33 articulations in our foot. We have 29 joints, 42 muscles, countless ligaments and tendons. So the foot is a very complex part of the body. It's a masterpiece of human engineering. And if it doesn't work in all the right facets, so if it doesn't heel strike properly, toe off properly, then you will end up developing issues with your feet and deformity of your feet, and that's why you see people getting very deformed in their feet. And then you add things like osteoarthritis to feet. It affects feet more than anything else. Diabetes affects feet very badly. So if you're someone who's diabetic, you have to spend particular attention to care for your feet, because it affects your feet through things like circulation, blood flow, and neuropathy, which is nerve damage as well. So this is why.
We'll be getting into the correlation between, diabetes and, of course, foot problems. So does foot problems cause diabetes, or diabetes cause foot problems? So
diabetes, as you know, is lack of insulin in the body, whether it's type 2 or type 1. Type 1 being totally inefficient to insulin, and then type 2 means resistant insulin. So what happens is your feet are the furthest thing away from your heart. So what happens is when the body comes under any form of strife, it protects the inner core and discards the outer core. That's never more said than the feet, because they are the outer core. They're the furthest extremity away. So diabetes affects the feet in 2 ways. Poor blood flow. So you don't get enough blood flow to your feet. So it's caused, we talk about something called ischemia, or PAD, peripheral arterial disease, which means you get narrowing of the arteries of the leg, which means then they don't get down to the feet, so you don't get enough blood flow. It's like let me explain it this way. It's like taking a hose pipe and running it around a corner. You block the water from coming out. So the water might get to where it's meant to be going, but it'll only be in a dribble. So it'll only give the plant a very small amount of water. So it's the same thing with blood flow. You don't get enough blood flow because it blocks the vessels. And then you don't get, and then what happens with diabetics is they don't feel. So a diabetic could walk around with a stone in their shoe all day and won't necessarily feel it. Upon removing their shoe, they've now developed what they call a DFU, a diabetic foot ulcer.
Yeah.
And a leg is lost every 20 seconds to diabetes in somewhere in the world. And every 2 seconds, someone will develop a diabetic foot ulcer somewhere in the world.
All right, interesting. Let's get some of the feedback from people watching us this morning to see what they're saying. We're talking about foot health this morning. What do you need to know about your foot health? Anne says, many people buy shoes based on fashion. What should we actually look for when buying healthy footwear? What should we look for when buying a healthy footwear, Dr.
So when you're buying shoes in the future, make sure that the shoe bends properly. Make sure it's wide enough at the toe box so that it gives you enough support at the toe. Make sure that it's nothing over 2.5 inches, because anything over that then puts so much pressure on the forefoot that then you can cause things like calluses, corns. If you're diabetic, it can damage. You can end up with ulcers on your feet. So make sure you pick and always buy shoes in the afternoon. That's my tip to you, because your feet naturally swell in the day. And also, when you measure your foot, use a special measuring foot system like this, and you stand on it. And you measure it like that. Don't, you know how when you go to certain shoes and they get you to sit on that chair?
Yes.
And then you put your foot like that. Your foot will increase by 1 to 1.5 sizes when you start walking. So you need to make sure you measure it when you're standing. And most companies now, shoe companies, will have these systems like Clark's in the UK. You'll stand on a machine and they'll measure your foot in a standing position to allow accommodation for sizing and room for the foot to move. Okay?
Yeah.
And when you put a shoe on, if it bites you straight away, don't buy it. And also, if you feel like it's too big, because you know some people go, oh, well, I'll buy 2 sizes more because I want to grow into it. And this is what they do with kids as well. And that's another thing we can have a quick chat about is podopediatrics, which is kids' feet, which are incredibly important. Because if you don't look after a child's foot, it leads to a life of complications and pain in your feet as you get older. Okay? So remember, footwear is incredibly important. Things that like this don't give you any support. Gumboots are another one, which are very commonly worn in rural areas because they protect the foot, but they don't allow the skin to breathe. They don't have any movement. And what happens is when you walk in a gumboot and you walk very flat-footed, you don't heel to toe because you're not able to do that. Things like simple sandals as well, things like this, they have no structure, no support. You can see that the whole of the last of that shoe has collapsed inwards because this person obviously puts a lot of pressure on the inside of their feet. So again, and then you've got things like this, which is the classic Gen Z things, the slides, where people wear these all the time because they can't be bothered to put shoes on. So remember, these are also not good because they don't support the foot, they don't hold the back of the heel as well. So generally, and I'm going to show you, trainers are good shoes. So if you have any complications, trainers are good shoe. I can see one of our cameramen there he's taken it off, so we'll go through that in a minute. But a shoe should bend here, and it shouldn't collapse. And generally lace-ups are better because you can adjust and accommodate for sizing and space.
So is it important for the foot to breathe? Because you're saying, for example, gumboots, they don't give you, they don't give room for your feet to breathe rather.
So, and what happens with gumboots is you promote fungal infections in the feet because the feet don't sweat. Or they over sweat, and then what happens is they become hot and they become too moist, and then the skin just sweats excessively, and you end up with what they call maceration or sweating between the toes, and that then promotes fungal infections, doesn't allow the skin to breathe. The condition of the nails then becomes sort of damaged because you're never allowing breathe. So I've always said, get your shoes off at the end of the day, give your feet some air, let them breathe, because you would never, if you wrapped your hand all the time, it would become very uncomfortable. The skin would become very uncomfortable, and you'd find. So you need to take your shoes off. You need to have open shoes on occasion. It's very important. You know, gone are the times where you need to be in closed shoes all the time. You should actually give your feet and allow them to breathe. And actually, this new generation are much better with footwear than my generation were. My generation was all about fashion and style and those pointed sort of brogues and stiletto heels and things, but the newer generation are much more conscious about foot health and generally looking after their feet.
All right. Before we get some feedback from what people are saying, some clarity on that measurement that we need to use for toes. Now, not everybody will be able to afford that or get that in their homes or anywhere or wherever. I've never even seen this thing. I'm seeing it here for the very first time. So what other alternatives can we use? Because you see, back in the days where I come from, we used to use maybe a piece of paper or maybe a string. Is that effective?
Yeah, so you can. So you can stand on a piece of paper, and this is why I've bought this. It's called a Harris mat. So it takes an impression of your foot using a footprint, and it can tell us how big the foot is. So that's exactly it. As long as you're standing, then you draw trace around the foot. You can also put it into cardboard, cut round that and take that. And then put that into a shoe. And if it fits very snugly into the shoe, then it's it'll be a good fitting shoe. So you can always measure that. The other thing you can do, for kids' shoes, is for parents, if you're measuring a child's foot size, you can turn the shoe upside down and it should be 1 to 1.5 fingers. That's the distance you need from where the toe ends to where the shoe ends. Okay?
Yeah.
So you measure it by your largest finger. So you can use your thumb or you can use your 2 fingers, and that's how much room you should get. So it should be about 1 centimeter, give or take, in front. You should have some room. So if you put a shoe on and it bites already at the front, don't buy that shoe, because literally, particularly for children, they'll be out of it very quickly. And then, of course, parents go for 2 sizes up because they say, oh, the child will grow in. What they're doing then is they're allowing too much play in the shoe for the child, and then that will damage the child's feet when they get older. So you don't want to do that.
Interesting. Let's get some more feedback and questions. We have... this is Mary, and she says, why are people living with diabetes advised to take extra care of their feet?
So, Mary, that's a very good question. Diabetics are, because of the sheer fact that they don't get, what happens in the foot is you don't get enough blood flow to your feet. So you end up, if you develop a wound or an infection on your foot, it can turn into gangrene. So just like something like this, like I bought, and I bought that, that's a classic diabetic foot. And you can see that there's an ulcer there. The toes have gone black to do with gangrene because there's not enough blood flow to your feet. So remember, if you are diabetic, the most important thing as a diabetic is to make sure your metabolic control, which means your blood sugars, are under good control. Because if you allow your blood sugars not to do that, that was when complications, particularly in the feet, do you realize it's one of the cheapest things to look for as diabetic foot complications? But if you end up in hospital with a diabetic foot complication, you are now looking at 30 to 50,000 shillings a day just to be in hospital. And if you end up needing wound management, it's 5 to 10,000 shillings every time you have to have that wound managed. You end up with an amputation because of diabetes. You are looking at now 200 to 1 million shillings for an amputation. It is the most expensive complication to do with diabetes if it ends up going wrong. The other problem that diabetes affects is something called neuropathy. Neuropathy is nerve damage. So our body is full of thousands and thousands of nerves, and they have to run where? So they all run down to the feet. So what happens in neuropathy is there are 3 types of neuropathy in diabetes. There's sensory, autonomic, and motor. Motor means changes. So your bone starts to develop bony changes. Your foot starts to change its walking pattern. So what happens is the bones start to drop and the foot starts to change its position. And that's why you see people who are diabetic and have been diabetic for a long time, they shuffle or they don't walk properly. So we always suggest that if you are a diabetic, and when you go to see your endocrinologist or your diabetologist, make sure that you show them your feet. Because if you don't, you could be leading to a very quick complication and eventually leading to an amputation if you're not careful. The other thing it affects the feet is you cannot feel. So you could walk around with a stone in your shoe all day, and because your nerves are damaged, it's like the wires of the cable on the floor here. If you cut the rubber of the wire off that, then the circuit is broken. It still may work, but not very effectively. So what happens is the nerves are surrounded by something called a myelin sheath, which becomes damaged to the point that it's then non-functioning. And that's why so diabetics are prone to lack of feeling and blood flow issues. And that's why they are so affected by diabetes. And not just diabetes, cardiovascular risks, people with autoimmune issues, with immune issues, people who are generally unwell will end up suffering from serious foot complications.
Just on that point of diabetes, before, of course, we take a look at some of the feedback that we're getting. Many amputations in diabetics, like you've mentioned, are preceded by foot ulcers. Then why is it so hard to notice this, let's say these ulcers early enough?
Because again, what we're dealing with, Anne, we're dealing with lack of feeling. So, and you see your feet are out of sight, out of mind. So if you are someone living alone, you are diabetic, and you have developed a foot ulcer, it may be a week before you actually start to realize there's an infection. And what will happen is it'll bring to the attention because you'll be running a fever. You'll lose your appetite. Your foot will start smelling. You will start seeing wet on the floor. And by that stage, you've developed a severe infection. You've left a porthole for infection to enter, and now you've got a serious infection leading to septic arthritis, gangrene, and cellulitis, which is soft tissue. So yeah, you won't notice, and it's too late by then.
Are clinics able to detect it early enough if the patient can't really feel anything? Are clinics able to notice it? Yeah,
so 85% are preventable if early detection is things. So this is why prevention is much better than cure, because as you know, diabetes is a condition. It's managed, right? So what you do is when you're diabetic, you have yourself checked, just like you'd have your teeth checked, your eyes checked. You'd go to see the doctor and they would say, okay, go and how are your teeth? How are your eyes? Are you walking properly? These kind of things. Have your feet checked. Even if you are, this is my advice to you, every diabetic should have their foot checked, irrespective of whether they've been diabetic for 5 minutes or whether they are a person living with diabetes who has been diabetic for 20, 30 years. Have your feet checked. And we've often said the feet are quite a good barometer. So if your feet start to become, if you are diabetic and you start to get numbness in your feet, irritation in your feet, pain in your feet, it's a good sign to say that now you are starting to develop vascular complications within your feet.
All right. Let's get some more feedback. We have Peter, and he says, at what age should parents start paying attention to their children's foot development?
Right. So the average age for a child to walk is basically from about 1 year old to 18 months. That is within the parameters of the normal milestones. Okay? Generally, I have a lot of parents who will come in and they will bring their children in before they can even walk and say, my child's foot is flat. My child's is standing in the wrong position. I don't like where the toes are going. And at this stage, we do very, very little, unless they're born with something called talipus or clubbing of the feet, and which you have to intervene at birth. But what you do is you allow the child to start walking properly, because you don't develop a distinctive walking pattern until you're about 3 to 6. So we don't really intervene in fixing children's feet biomechanically speaking, or correctly, structurally supporting their feet until they're around 6 years old. It's like riding a bike. You ride it at a certain age and you're always very wobbly. And that's why you see 3-year-olds walking a little bit like ducks. They either walk like penguins or they walk like ducks. They go in or they go out, and they're slightly unstable. It's because they're not quite sure of where their foot wants to be. So they're working out a distinctive walking pattern for themselves. And then, of course, I get a lot of parents who come in and say, oh, you know, my child's flat-footed. Well, your arch won't fully form because the foot hasn't developed yet. Do you realize in your foot, as a baby, you have over 300 bones in your feet, in your body. As an adult, they're 206. And most of those auxiliary bones are in the hands and feet because they haven't formed yet. So if you look at them, if you look at the phalanxes, which is these big, here we have 3, 1, 2, 3. In kids, they're 6 when they're born. They haven't fused yet. So this is why the foot is you have to be very careful. So again, with parents, don't start putting your children into those nice, fancy shoes at a very early age, because what you'll do is you'll force the foot to develop in a position it doesn't like to be, and that could cause the child problems later on. But the good thing is, if you get children early and you identify risk factors relating to biomechanical issues, you can fix their feet before they become an adult.
What are some of these risk factors to look at?
So risk factors, so if your child walks very internally rotated, walks externally rotated, such as pronation, supination, they walk on their toes. So there are a lot of children who are toe walkers. And I get a lot of parents who will come in and go, my child isn't putting their feet down. They're still walking on their toes. Most children walk on their toes because it becomes a habit. And then when it becomes habitual, then they can't put their feet down. So you have to identify whether it's functional, whether they can put their heels down or whether they can't. If it's structural, then it requires more treatment, such as possible surgery. But if it is functional, then just by simply giving the child a simple insole like that, okay, which is a pediatric insole, with maybe a heel raise to identify, and then eventually you remove it until the child is flat again. But you can retrain a child to walk correctly, because your muscle memory will not become constant until you're about 16. So as long as you get children early, you can actually fix any biomechanical issues, depending on, of course, the severity of it, and if it's structural. Because if it's structural, then you have to involve the orthopedic surgeons, the podiatric surgeons, and the pediatricians to come in as a team and work out what you do.
So at what age should kids start wearing shoes?
So it's a very good question, because it depends on the child, of course, but generally I wouldn't put children into anything soft shoes, trainers, lightweight shoes. Remember, the rule of thumb is very lightweight. Don't put them into anything heavy, because they'll drag their feet and they'll start walking in the wrong way, and you'll start forcing a biomechanical fault. So generally, when they start walking properly and develop a distinctive walking or gait pattern, so probably from about 4 to 6 properly. Otherwise, children can wander around, but obviously if they're wandering around in the garden and stuff and they stand on something that's going to hurt them. So soft shoes mainly, but don't, and again with babies, don't put your children into these tight hosiery, you know, these onesies that people in, because what will happen is you will change the structure of the toes, and then people end up with curly toe syndrome. They'll end up with clawing of the toes, because you're forcing the foot into a position it doesn't want to be in. Okay.
You mentioned something about children being, toe walkers, and I thought about ballet dancers.
Yes.
Do they have long-term, risk and complications because they dance on their toes?
So ballet dancers are a different sort of, let's put them over there. Ballet dancers, if you are a professional ballet dancer, you are guaranteed to have foot problems as you age, but it's it's a hazard of the job. You are training to be a ballet dancer. No one should be standing on point. Point is where you stand on one of your toes, right, and you stand on that. And I'm not saying, if you are someone who wants to you want to follow ballet, you want to become a professional, please do. It's a wonderful profession to be in. But what I'm saying is, it does damage your feet. You have to be very, very careful. You have to look after your feet, because you are basically putting all your weight on your toes like that and standing on point. And that first ray is not meant to take all the weight. So ballet dancers are very likely, and they get into their 40s and 50s, to have sort of bony changes in their feet. So their foot will start to, they'll get deformity in the front of their foot. They'll get pain in the toes. What happens with people who put a huge amount of pressure through the front of the foot is the joints become less, so that you don't get enough movement. So it's like a hinge that doesn't work efficiently. So that's why ballet dancers are much more prone to developing sort of forefoot pain and forefoot arthritis when they get older.
All right.
Okay.
Interesting. Let's see what the people are asking. A lot of questions coming in for you this morning. We have, this is Kevin, and he says, I often experience heel pain when I wake up in the morning. Could this be a sign of a serious foot problem?
Okay, Kevin. So basically what you're talking about here is heel pain. Heel pain, there are over 100 different differential diagnoses of heel pain in podiatry. right? But the most common one, which a lot of people suffer, is you say you get pain when you get out of bed in the morning. And that, when we ask patients if they get pain in their heel when they get out of bed in the morning, this is going down a track of something called plantar fasciitis or heel spur syndrome. Now what happens is, our foot is aligned by connective tissue or fibers, thick fibers, like a duck's webbing on a foot, that supports, and it attaches to the heel bone at the back here on the inside. Now, as we get older, that fascia becomes less elastic. Just like, well, that's why people are also prone to Achilles tendonitis and snapping their Achilles tendon when they get into their 40s and 50s, because there's less elasticity from the tendon. So the same thing happens with the foot underneath. The fascia becomes less and less elastic, and it starts to tear or detach from where it actually inserts into what they call the calcaneus, which is the heel bone. And that's why it hurts, and why it hurts so much when you get out of bed in the morning. If you take a rubber band and you pull a rubber band to here, you can stretch it to here. But if you put it in a drawer overnight and pull it back to where it left off the day before, it'll snap or tear. Why? It's cold. So, and again, let's go back to the blood flow. That area gets very little blood flow because it's the furthest thing away from the heart. So what happens is there's not enough blood flow to that area. So that's why that fascia is likely to tear. And the problem is why it affects your feet so much is you walk on your feet. So if I was to tell Kevin, if you go to bed for 6 weeks, your fascia will heal. But if he did that, that would be, you can't do that. You have to walk. So this is why foot problems become so chronic. And what happens is, so what my advice to you, Kevin, is basically go and check your shoes, wear the right type of support, okay? Make sure you stretch your feet properly before you go to bed and also before you get out of bed in the morning. If it's acute or you're getting severe pain, then what you can do is you can take some anti-inflammatories or NSAIDs, which are non-steroidal anti-inflammatories, which might help the initial pain. But look at your, first port of call is look at your footwear. Stop overusing your feet. Make sure you stretch properly, because this is where people forget, and we forget to stretch. You know, we don't stretch. You know, we kind of thing, we just go and we play. It's like, and you can do it in your 20s, you can do it in your 30s, but when you get into your 40s and 50s, not so easy. So if you are still playing a decent sport, you need to make sure you stretch properly, and that's never more said than in the foot. So plantar fasciitis is self-limiting. It will go away eventually, but you've got to do the right things, and this is why people end up going, and then you can, if that doesn't work, you can always have a hydrocortisone steroid injection into the foot, which helps to calm down the inflammation. But the first port of call is reduce the inflammation, and you do that by offloading it, making sure you wear the right shoes. Insoles help very much, you know, insoles to help balance your foot and make sure you don't stress your fascia. So you need to get some of these. You can buy them off the shelf as well, bespoke insoles they're called, or they can be customized. It's like having prescription glasses or just lenses you can pick off the shelf. So you wear insoles, you make sure you stretch properly, you take the right medication at the right time, and you make sure you don't overuse it. And again, just make sure you rest your foot if it needs to. So for the next week, if you're getting it and it's acute, make sure you rest for the next week. Don't do that jogging that you do every morning.
All right. Just a follow-up on his question. You mentioned something about stretching, right?
Yes.
So how do we stretch the feet?
So generally stretching the feet, standing on the edge of a step, dropping down, making sure you stretch the fascia. There are lots of different stretches, and this is where you talk to the physical therapist. And we have some very good physiotherapists in Kenya who can sort of take you through an exercise program on how to stretch properly. And the thing is, and I think that's where, you know, my biggest problem now is getting into towards 50 is putting my shoes on in the morning. It's a struggle because, and you know, as men, we tend to be we're a lot less supple than women. Women tend to sort of do a bit of stretching. Men, we tend to sort of wait until everything sort of seizes up before we do anything about it. So stretching is incredibly important, and that's never more said that when you get into middle age, you need to be stretching regularly. So if you're wanting, you can Google stretching. It's just general foot stretches. Google just general lower limb stretching and that kind of thing. Or go and see a friendly physiotherapist, and they will basically be able to give you some advice on how to stretch properly.
A friendly physiotherapist. All right, let's get more feedback. We have, this is Brian, and he says, how does poor foot health affect the rest of the body, like the knees, the hips, or back?
So Brian, imagine this. If the tires of your car are worn down on one side, what will happen to the suspension further up the chain? What will happen is you will end up developing issues with your suspension from the bushes to the chassis of the car. It's never more said than in the same as feet. So if your feet are flat, or you are pronating, or you walk in the wrong way, or you've had an accident previously, I've often said a car never drives the same if it's ever had an accident. Doesn't matter how you sort of wrap it up and make it look really nice. It will never drive the same. So again, it's the same thing with the feet. What happens is if you are someone who's naturally high arch, it's called the Pacavus foot type, you're going to walk very much, your foot's not going to shock absorb properly. So then you're more likely to develop shin pain, knee pain, and hip pain. You know, if you don't put the foundation of a building in properly, right, and don't dig it properly, the building will be unstable.
Yeah.
If you build a wall and you build a wall, so when you build a wall, you build every brick absolutely symmetrical on top of each other. Why? Because you get strength there. But if one of those bricks is slightly off or adjacent to that, there's a fault line there. And if you probe that fault line, it becomes problematic. So that's the same with biomechanics, means the way we move. It's known as MSK, it's musculoskeletal balances. And what happens is, as podiatrists, is we are the specialists in relating to correcting the way people walk and move. So we look and we study biomechanics of the foot, relating to how the person should walk. And then we can advise them correctly, but it doesn't happen to everybody. But generally, Anne, what happens with biomechanics is if you are someone who has got a problem with your foot, it will transfer weight to your knees and to your back and eventually to your neck as well. So we talk about posture, we talk about insoles, you know, you can take casts of people's feet like that so that they can have, and if you notice this cast, you can see the arch is excessively high here. So this person will develop pain in here, probably at the back here, and if you look at that, that's unstable. That would become unstable. So you can see you can move that very easily. So that's an unstable foot. So what you need to do is stabilize that. So if you put it on an insole, it becomes more stable.
All right.
See that? So then that means that supports the whole body, supporting the chain reaction all the way up. You know that song you sing to kids, your leg bone's connected to you?
Yeah.
Yeah, that's the whole thing. And we're all connected biomechanically.
All right. So which one is better? Is it a flat foot or this highly raised foot? Because this looks quite complicated. It has to be supported by something for it to be stable. But a flat foot is just flat. It's on the ground.
Yeah. So flat feet doesn't equate to a problem. A lot of our Kenyan runners, and we have the best runners in the world, are flat-footed. That doesn't equate to a problem. A biomechanical fault does. So flat feet doesn't necessarily mean that you are going to have serious knee pain or serious leg pain when you get older. It just means that the arch profile never really formed, and it's often genetic. So we often say, your parents were flat-footed, so you're likely to be flat-footed. Where the problem comes in is if you start developing what they call a fault, because when you're flat-footed, you're more likely to overcorrect, and your foot is more likely to turn inwards. And that then causes pain up the medial side of the leg, which then transfers into the knee and into the back, respectively. So this is why. And then again, the same with the high arch foot. If you have a high arch foot, then you're unstable because your surface area isn't balanced. And you tend to put a lot of pressure on your heel or on the front of your foot, which then forces you to then use the outside of your feet more. And in doing that, you use the outside of the legs, which then lead to the hip, which is why a lot of people with high arches are more prone to developing hip pain.
We have the best athletes, as you've mentioned. So what are some of the injuries that are common with them? Foot injuries. Yeah,
so this is part of why, as podiatrists, we now study sports medicine as well. And you know, I am in the very fortunate position of being able to work in Kenya and being able to work with the world's best when it comes to athletics. But you see, what happens with athletics is it's overuse injuries. So often it's doing something continuously and expecting a different result. So you know, we had an interesting story of an athlete who basically, a brilliant athlete, best in his field, and he developed an impingement. an irritation of something on his foot. Because we found out when we looked at his foot, we examined his foot, and yes, he had a bit of a high arch foot. He was struggling with a little bit of balance, but that wasn't the problem. You know what it was? He was running around the track the same way in the same practice for 10 years. And he had impinged on that. So he was doing the same thing every day and getting continuous pain. The physios looked at him, everyone looked at him, no one could work out why he was developing this pain. And all we did, the simplest solution is we got him to run around the track the other way. And the problem went away.
Oh, wow.
So generally, foot problems can be very easily solved. You just have to think outside the box and deal with it. And athletes are, you know, our Kenyan runners are the best in the world. If you look at the way they run, they are absolutely beautiful. They run heel to toe perfectly. And you know, this is why a lot of the West, they've designed these shoes now, these rocker shoes. You know, shoes that rock, so they rock you through. They almost look like a boat. Because what they're trying to do is they're trying to mimic that running style because it's so efficient. And this is why, and I think, you know, our athletes here, their way of running, the way of moving, the muscle structure in their lower is fantastic.
It's a bit different.
Yeah, different in the way that, you know, their biomechanics is so amazing. You know, they're so efficient. They maximize energy. You know, I often say if someone has a biomechanical fault, it looks like they're trying to walk. It looks like it's almost like an effort. But if you look at a perfect athlete, like a Kenyan athlete, the way they run is just beautiful. It's that poetry in motion. It's that heel to toe movement, which is so efficient.
All right, let's get some more questions. We have, this is Samuel, and he says, how can someone keep their feet healthy, especially people who stand for long hours at work? Let's get some more. This is Lillian. Are pedicures safe for everyone, and how often should someone get proper nail care?
So let's start off with keeping...
Let's get this one too. What is gait analysis, and how can it help someone who has foot or walking problem? All right.
So let's talk about the foot health, right? Generally foot health. You know, how many of you will wash your feet in the shower, dry them on the towel, and put your socks on? Most of us. We don't sit there and look at our feet, check our feet, look between the toes, check for any sort of signs of irritation of the skin, look at the quality of the nail care, look to see if they've been cut properly, look to see if they're becoming ingrown. We never look at that. So just inspect your feet. Daily inspection of your feet is very important. If you've had a long day and you've been in shoes all day because you have a job that requires you wear shoes all day, take your shoes off, allow your feet to breathe, check the skin quality, check the temperature, make sure you look at the quality of the nails. If you are someone who sweats a lot, make sure you dry your feet properly. You know, I've often said as you age, you can't get down to your feet, but you can use a hairdryer to dry your feet. Because most of us have partners married, and my wife has a hairdryer. I struggle to dry between my toes, but I can use a hairdryer to do that.
Oh, wow.
You know, but don't do that if you're diabetic, because you don't want to burn your feet as well. So generally, foot health is just looking for things, controlling things, making sure that you examine your feet thoroughly and check. You know, you clean your teeth twice a day.
Yes.
But when do you ever look at your feet?
Every day.
Okay, that's good, and I'm very happy you do that, so you look at your feet. But the majority of people don't do that. They don't look at their feet. Their feet are out of sight, out of mind. Those feet are those things on the end of your legs. But those feet on the end, I've often said the foot is like the donkey of the body. It does all the hard work, but gets treated with the most disdain.
Somebody asked about pedicure. Is it safe for everyone?
So pedicures, yeah, this is a big one. Pedicures, yes and no. Depends on the pedicure. It depends on how they deal with the pedicure, what they do. You see, very often you'll go to the pedicure and they will rub all the hard skin off your feet when it's wet. All that does is create hyperkeratinization or granulation of the skin. You should always rub hard skin off when it's dry. Because when you do it when it's wet, the skin produces more cells to protect what it thinks is being damaged. And this is why a lot of people will say, I used to go to the pedicure every month, and now I go every 2 weeks. And now the skin's getting even worse, and now I'm having real problems. So pedicures are fine, but you've got to do them in the right way. So the hard skin should only be removed when the foot is dry. Then you can soak the foot, then you can put moisturizers on the feet. Again, nail care. Don't cut the nails and follow the contours of the nail all the way down, because you are likely to put to give the person an ingrowing toenail. And I see so many people who come into the clinic because they've gone for a pedicure, they haven't had the pedicure deal with it properly, and now they've developed an ingrowing toenail. And again, sterilization is key. You need to make sure that the instruments that they use are properly treated and sterilized, because they breed infections sometimes in these places. And if you've got a patient who's had a fungal infection, and then they're sharing the same bath mat, or they're sharing the same sort of soaking of their feet, then what will happen is you'll be breeding infections in these places. So you've got to be careful.
Cracking toes, is that harmful to the feet?
As in cracking the toes?
Cracking toes? You see this thing?
Yeah. So
is it harmful?
Yeah. So what you do when you crack a digit, is you release a gas into the digit space. So what happens is people who crack their fingers and toes all the time are more likely to develop arthritis at an earlier age than people who don't do that. You shouldn't crack. You know, it's that release. You did that. So I presume when you do that, you get that, oh, it's a release.
Yes.
But then you can't, but you wouldn't be able to do it straight away again. You'd have to wait for the gas exchange to replace before you could do it again.
Yeah.
And we need that to protect the joint lining.
So as we wind up this conversation, Dr. Ari, any last words of advice for viewers this morning with regard to just choosing the right footwear and, of course, just taking care of general foot health?
Always buy your shoes in the afternoon, everybody. Make sure that the foot is, that it fits the shoe properly. If you have that little voice in the back of your head that says, no, this is not a good shoe, don't buy it, because it will eventually affect your feet and damage your feet. Make sure you look at your feet every day. Check your feet before you sleep, and make sure that that you always just generally buy the right shoes in future. Make sure trainers are properly supporting you, and make sure if you have any foot pain in any way, seek medical advice, because if you don't, it could lead to a problem. And that's never more said than if you are diabetic. You know, make sure, you know, I've often said, treat the whole foot, not just the hole in the foot.
All right. Okay. This is a very interesting conversation, and we've come to the end of it. But if somebody wants to follow up with questions, or maybe they have an ingrown, like you mentioned, a lot of people come to the clinic with ingrown issues, then how can they find you?
So we run, as podiatrists, you know, it's a subspecialty of medicine. There are very few podiatrists in Kenya. I think to date, we are now registered. There are 8 of us.
Only 8
are registered, and now it is recognized as a subspecialty in Kenya. Podiatry has its own board now, an own thing for being registered. So we've gone from an unregistered profession even 5 years ago to now a registered profession. And we have services available at Lions Eye First Eyesight Hospital, MP Shah, Jalaram Health Services. We have clinics as well. There are podiatrists. I know my colleague works on, she has a clinic on the Angong side near Nairobi Hospital. We have another one at Spring Valley. And if you ask around at hospitals, podiatry is now available. And we are trying to develop a homegrown podiatry service. And we're actually now starting to educate. And we want to eventually have a full degree program for podiatry. That's my aim. To actually be able to advocate for more foot health and keep people's feet healthy in the future. All
right, interesting. Let me just bring in my co-host. We started the show with him at 6 a.m. And you know, when we're starting the show, even me, I didn't quite know what podiatry is about. I wonder, Fred, if now you are in the loop?
Oh, yes. I didn't know we could discuss foot health for that kind of period. It was very interesting, and thank you so much for all the insights. And of course, I'm sure there are some more questions online for Daktari. If at all, you keep them coming through our social media pages, TV47 Kenya, TV47 Kenya on YouTube and Facebook, TV47 Digital on X. We'll make sure we get them answered for you.
All right, my handle is at @Ann_Dida.
At Fred Indimuli.
Thank you so much, Daktari.
Thank you for having me. Appreciate it.
Thank you so much for watching, and we'll see you tomorrow bright and early. Good morning.
Good morning.